The at-home tests are antigen tests, which are not the same as PCR tests, and they're done at your local pharmacy or doctor's office.
So, yeah, what exactly is the difference? Some parents may be confused here, and which one is better that the experts recommend? KCRA3's Orko Manna live now in the newsroom with more of these facts. So, Orko?
Well, with COVID surging right now in California, getting tested for the virus is really important, especially if you're experiencing symptoms. And while the at-home tests are convenient and easy, experts recommend getting the PCR test if you can. COVID-19 cases are up in California due in large part to the rapidly spreading Omicron variant.
When we hear that information, it can be very alarming.
That's why Dr. Hakeem Adeniyi with the Sacramento Native American Health Center says getting tested for COVID is so crucial right now.
Whenever there's symptoms, definitely looking at getting tested. Assume that you may have been in contact and may have contracted it.
At-home COVID tests are the antigen tests which can detect an immune response to COVID. They're becoming widely available in our region, but Dr. Adeniyi says PCR tests are still the gold standard. Those tests are done in a pharmacy or doctor's office, and they look for the genetic markers of COVID.
Even if you're not completely symptomatic at the time, a PCR test will pick up the virus. But with an asymptomatic individual, it's much less likely that the rapid test is going to come back positive, even if they have virus in their system.
But Dr. Adeniyi says if the viral load is large enough, at-home tests are still accurate when they say you're positive. If you do test positive with an at-home test, Dr. Adeniyi stresses the importance of alerting health officials in the interest of keeping the community safe through contact tracing.
It is based on the honor system and people being willing and able to share that information so that we can do it from a public health standpoint to look at who they may come in contact with. It's not something that would readily go into the public database.
Dr. Adeniyi says everyone needs to do their part.
I'm hopeful as we continue to have more access to testing, to vaccines, to treatment that we can turn the corner, but we still have some work to do.
Now, regardless of what test you take, the timing is crucial. Dr. Adeniyi says to wait a little bit after a potential exposure, since it takes about 3 to 5 days for a positive test to appear. Live in the newsroom tonight, Orko Manna, KCRA 3 News.
Okay, yeah, we know a lot of people still have questions about this stuff. Orko, thanks.